My name is Joshua, and for this video of the neuroanatomy series, I will be presenting on the topic of the spinal cord. The spinal cord is a cylindrical grayish-white structure that begins above the foramen magnum, where it continues with the medulla oblongata of the brain. The spinal cord, alongside the brain, form the central nervous system and essentially acts as the communication system between the brain and the rest of the body. Within the spinal cord, there is no obvious segmentation, but for convenience, the naming of the spinal nerves is based on the segment in which they are located. The spinal cord is located in the vertebrae foramen and is made up of 31 segments, 8 pairs of cervical nerves, C1 to C8, 12 pairs of thoracic nerves, T1 to T12, 5 pairs of lumbar nerves, L1 to L5, 5 pairs of sacral nerves, S1 to S5, and 1 pair of coccygeal. It terminates inferiorly in the adult at the level of the lower border of the first lumbar vertebrae, therefore occupying around 2/3 of the vertebrae canal. However, in children, the spinal cord is relatively longer and ends inferiorly at the upper border of the third lumbar vertebra. During early childhood, both the spinal cord and the vertebral column grow longer as part of the overall body growth. Elongation of the spinal cord stops around age 4 or 5, but growth of the vertebral column continues. Thus, the spinal cord does not extend the entire length of the adult vertebral column. The length of the adult spinal cord ranges from 42 centimeters to 45 centimeters. Its maximum diameter is approximately 1.5 centimeters or 0.6 inches in the lower cervical region and is smaller in the thoracic region and at its inferior tip. When the spinal cord is viewed externally, two conspicuous enlargements can be seen. The superior enlargement, or the cervical enlargement, extends from the fourth cervical vertebra, C4, to the first thoracic vertebra, T1. Nerves to and from the upper limbs arise from the cervical enlargement. The inferior enlargement extends from the 9th to the 12th thoracic vertebra. Nerves to and from the lower limbs arise from the lumbar enlargement. Inferior to the lumbar enlargement, the spinal cord terminates as a tapering, conical structure called the conus medullaris, which extends at the level of the intervertebral disc between the first and second lumbar vertebra in adults. Arising from the conus medullaris is the filum terminale, an extension of the pia mater that extends inferiorly, fuses with the arachnoid mater and dura mater, and anchors the spinal cord of the coccyx. As previously mentioned, along the whole length of the spinal cord are attached 31 pairs of spinal nerves by the anterior or motor roots and the posterior or sensory roots. Two bundles of axons, called roots, connect each spinal nerve to a segment of the spinal cord by even smaller bundles of axons, called rootlets. The posterior root and rootlets contain only sensory axons, which conduct nerve impulses from sensory receptors in the skin, muscles, and internal organs to the central nervous system. Each posterior root has a swelling, the posterior root ganglion, which contains the cell bodies of sensory neurons. The anterior root and rootlets contain axons of motor neurons, which conduct nerve impulses from the central nervous system to effectors, such as muscles and glands. As spinal nerves branch from the spinal cord, they pass laterally to exit the vertebral canal through the intervertebral foramina between adjacent vertebrae. However, because the spinal cord is shorter than the vertebral canal, nerves that arise from the lumbar, sacral, and coccygeal regions of the spinal cord do not leave the vertebral column at the same level they exit the cord. The roots of these lower spinal nerves angle inferiorly alongside the filum terminale in the vertebral canal, collectively called the chorda equina. A transverse section of the spinal cord reveals regions of white matter that surround an inner core of gray matter. The white matter of the spinal cord consists primarily of bundles of myelinated axons of neurons. Two grooves penetrate the white matter of the spinal cord and divide it into the right and left sides. The anterior median fissure is a wide groove on the anterior ventral side. The posterior median sulcus is a narrow furrow on the posterior dorsal side. The gray matter of the spinal cord is shaped like the letter H or butterfly and consists of dendrites and cell bodies of neurons, unmyelinated axons, and neuroglia. The gray commissure forms the cruspa of the H. In the center of the gray commissure is a small space called the central canal. It extends the entire length of the spinal cord and is filled with cerebral spinal fluid. At its superior end, the central canal is continuous with the fourth ventricle in the medulla oblongata of the brain. Anterior to the gray commissure is the anterior or ventral white commissure, which connects the white matter of the right and left sides of the spinal cord. In the gray matter of the spinal cord and brain, clusters of neuronal cell bodies form functional groups called nuclei. Sensory nuclei receive input from receptors via sensory neurons, and motor nuclei provide output to affected tissues via motor neurons. The gray matter on each side of the spinal cord is subdivided into regions called horns. The posterior gray horns contain axons of incoming sensory neurons, as well as cell bodies and axons of interneurons. Between the posterior and anterior gray horns are the lateral gray horns, which are present only in thoracic and upper lumbar segments of the spinal cord. The lateral gray horns contain autonomic motor nuclei, which regulate the activity of cardiac muscle, smooth muscle, and glands. The white matter of the spinal cord is also organized into regions. The anterior and posterior gray horns divide the white matter on each side into 3 columns: the anterior or ventral white columns, the posterior white columns, and lateral white columns. Each column in turn contains distinct bundles of axons having a common origin or destination and carrying similar information up and down the spinal cord called tracts. Here on the screen are 5 spinal cord segments, one taken for each region of the spinal cord. In regards to the cervical spinal cord segments, they tend to usually be relatively large in diameter due to having large amounts of white matter. In regards to the shape, they tend to usually be oval, and in the upper cervical segments, C1 to C4, the posterior gray horn is large, but the anterior gray horn is relatively small. In the lower cervical segments, C5 and below, the posterior gray horns are enlarged and the anterior gray horns are also well developed. In the thoracic spinal cord segments, they tend to usually have a smaller diameter due to having relatively small amounts of gray matter, except for the first thoracic segment. The anterior and posterior gray horns are relatively small, and a small lateral gray horns are present. In regards to the lumbar spinal cord segments, they are nearly circular in shape and have very large anterior and posterior gray horns. A small lateral gray horns are present in upper segments, however they possess relatively less white matter than cervical segments. Sacral spinal cord segments are relatively small, but contain relatively large amounts of gray matter in comparison to the relatively small amounts of white matter. The anterior and posterior gray horns are large and thick, while the coccygeal spinal cord segment usually resembles lower sacral spinal segments, however they tend to be much smaller. The arterial supply to the spinal cord is via 3 longitudinal arteries, which consist of the paired posterior arteries, which originate from either the vertebral artery or the posterior inferior cerebellar artery, and the anterior spinal artery, which is formed by the branches of the vertebral arteries and run down within the anterior median fissure. The posterior and anterior spinal arteries are reinforced by radicular arteries, which enter via the vertebral canal through the intervertebral foramina. The veins of the spinal cord drain into the internal vertebral plexus. Additional supply is via the anterior and posterior segmental medullary arteries, small vessels which enter via the nerve roots. The largest anterior segmental medullary artery is the artery of Adamkiewicz, which arises from the inferior intercostal or upper lumbar arteries and supplies the inferior 2/3 of the spinal cord. The spinal meninges are 3 membranes that surround the spinal cord. From superficial to deep, they consist of the dura mater, arachnoid matter, and pia mater, similarly to the brain. They also contain cerebrospinal fluid, acting to support and protect the spinal cord. All 3 spinal meninges cover the spinal column through the intervertebral foramina. The spinal cord is also protected by a cushion of fat and connective tissue located in the epidural space, a space between the dura mater and the wall of the vertebral canal. The dura mater is the most external membrane and is a dense, strong, fibrous sheet that encloses the spinal cord and the cauda equina. The dura mater forms a sac from the level of the foramen magnum in the occipital bone, where it is continuous with the meningeal dura mater of the brain, to the second vertebra. The dura mater ends at the filum terminale and is separated by the walls of the vertebral canal by the epidural space. The space contains some loose connective tissue and the internal venous plexus. As the spinal nerves exit the vertebral canal, they pierce the dura mater, temporarily passing into the epidural space. In doing so, the dura mater surrounds the nerve root and fuses with the outer connective tissue, covering the nerve, the epineurium. This layer, the middle of the meningeal membranes, is a thin avascular covering comprised of loosely arranged collagen and elastic fibers. It is called the arachnoid matter because of its spider's web arrangement of delicate collagen fibers and some elastic fibers. It is deep to the dura mater and is continuous through the foramen magnum with the arachnoid matter of the brain. Between the dura mater and the arachnoid matter is a thin subdural space which contains interstitial fluid. Distal to the conus medullaris, the subarachnoid space expands, forming the lumbar cistern. This space is accessed during a lumbar puncture to obtain CSF fluid and spinal anesthesia. The innermost meninges is a thin, transparent connective tissue layer that adheres to the surface of the spinal cord and brain. It consists of thin, squamous to cuboidal cells with interlacing bundles of collagen fibers and some elastic fibers. Within the pia mater are many blood vessels that supply oxygen and nutrients to the spinal cord. Triangular-shaped membranous extensions of the pia mater suspend the spinal cord in the middle of its dural sheath. These extensions, called denticulate ligaments, are thickenings of the pia mater. They project laterally and fuse with the arachnoid mater and inner surface of the dura mater between the anterior and posterior nerve roots of the spinal cords on either side. Extending along the entire length of the spinal cord, the denticulate ligaments protect the spinal cord against sudden displacement that can result in shock. That concludes the presentation, and thank you for watching. Here are some sources from further reading, and here are my acknowledgements as well.